All right, let's just dive right in. Welcome to this explainer on compassionate care and communication. Today, we're jumping straight into Lesson 2 of our Dementia Management series. To kick things off, let me just state exactly what this lesson is all about. We are equipping you to deeply understand cognitive decline so you can provide safer and honestly, just much more supportive care. So if you've ever felt stuck, maybe a bit overwhelmed, or totally unsure of how to handle a challenging interaction with a client, well, you're in the exact right place.
Because really, it's all about connecting the dots, right? Once you truly understand how a changing brain actually alters a person's behavior, dictates the way they communicate, and directly impacts their safety needs, man, your entire approach transforms. You stop just reacting to those challenging behaviors, and you start responding with genuine, informed compassion. So here's our highly structured roadmap for this explainer today. We're going to start with a quick lesson overview, unpack the core training topics, highlight the golden rule, look at a real-world application, and finally finish up with increasing value and trust.
Okay, moving into Section 1, Lesson Overview. Let's talk about the reality of home care.
And here is the sheer unavoidable reality of this job. A huge number of home care clients experience cognitive decline. Understanding dementia, it isn't just some nice-to-have bonus skill, it is absolutely non-negotiable for safe care. I mean, this isn't some rare, once-in-a-while thing, right? This is the everyday bread-and-butter environment of home care. You literally cannot provide effective care if you don't grasp these realities. Acknowledging that fact is your first real step toward becoming a way more confident, proactive professional. Building on that, let's jump into Section 2, Core Training Topics. This is basically your essential caregiving toolkit.
To master your role, you need a complete, interconnected toolkit. It's kind of like a giant puzzle. You have to know what dementia fundamentally is to figure out exactly how it's altering a client's behavior. And once you have that foundation, well, then you can deploy specialized communication techniques, learn how to de-escalate when tensions inevitably spike, use redirection to smoothly shift their focus, and put vital safety precautions in place. All these pieces have to work together as a single, cohesive system.
Now, during difficult moments, and we all know they happen, having a reliable, actionable sequence totally takes the panic out of the situation. It replaces it with structure. So Step 1, stay calm. Your grounded presence is basically an anchor for them. Step 2, communicate with compassion. Always remember that your tone, your body language, it matters immensely. Step 3, actively use those skills to de-escalate the tension. And finally, Step 4, provide ongoing supportive care. You don't have to guess in the moment, just follow these 4 steps.
Which brings us to Section 3, the Golden Rule. This is your ultimate communication strategy, hands down.
I really want this rule to burn into your memory. No matter the situation, do not argue. Redirect, period. When a client's brain is impacted by dementia, trying to force them to accept your logical reality is a losing battle. It's just going to cause agitation and completely break down trust. Redirection, though, that is a tool of profound empathy. You're acknowledging their reality, validating their feelings, and then gently guiding their attention towards something way more positive and a lot less stressful. Let's see what this looks like in Section 4. Real-world application in everyday scenarios. Okay, picture this. Your client insists it's time for a meal, even though they literally just finished eating. Your logical, knee-jerk reflex is to correct them, right? You want to say, hey, you already eat. But as we just learned, that breaks the golden rule and almost guarantees a frustrating argument. Instead, try pivoting, saying, let's have a snack together. Completely removes the friction. Poof, it's gone. You aren't arguing about facts or the clock. You're just meeting their emotional need in that exact moment and shifting to a pleasant, shared activity. It is wildly effective. And that leads us straight into our final section, Section 5, Increasing Value and Trust. This is the ultimate payoff for everyone involved. Applying these specific techniques doesn't just keep your clients safe. It is an absolute game changer for your professional value. It instantly deepens mutual trust. When you can seamlessly redirect instead of arguing, and when you keep your cool to de-escalate a tough moment, families notice. But honestly, more importantly, the client feels it. They genuinely feel safe with you. These aren't just soft skills. These are vital, high-value professional competencies that truly define the absolute best in the home care industry. So, to wrap up this explainer, I want to leave you with one final, provocative question to think about as you step into your next shift. How will redirecting with compassion transform your caregiving today? Take these frameworks, the essential toolkit, those 4 steps for managing difficult moments, and of course, the golden rule of redirection, and put them to work. You've got the knowledge right now to turn challenging situations into moments of genuine supportive connection. Thanks so much for joining me, and keep bringing that incredible value to the people who need it most.